GHS they want us to be like here only. They want to keep it because then they
No, then at least we'll refer him to.
every time.
How to write. ಅದಾದ್ಮೇಲೆ ಅದು
So, a very good morning to everyone. I, Dr. Poonam Joshi, welcome you all to our Head and Neck ACTREC academic classes. As today's speaker is Dr. Nivedita Chakrabarty. Dr. Nivedita is Associate Professor in Department of Radiology at Tata Memorial Center, ACTREC, Navi Mumbai. And she will be speaking on the topic radiological anatomy of temporal bone and base of skull. So with this, we welcome Dr. Nivedita Chakrabarty. Dr. Nivedita, please share your slides.
Yes, thank you, ma'am. Good morning, everyone. Is my slide visible?
Yes, it is.
Okay, just a minute. All right. So, I'll be speaking on the imaging anatomy of temporal bone and skull base. So I'll be basically showing you a series of images. So none of my slide has any theoretical content. So theory part you can read up from websites and books. But my goal through this presentation is to enlighten you on the key imaging structures. Okay, so just a minute, I'm not able to. Okay, so temporal bone. What do you know about the temporal bone? So we are all aware there is external ear, middle ear, and inner ear. So inner ear structures contain the cochlea, the vestibule, the semicircular canals. Middle ear houses the ossicles, the malleus, incus, and stapes. The medial wall of the middle ear cavity contains the tympanic segment of facial nerve, oval and the round windows. The middle ear is separated from the external ear by the tympanic membrane. The external auditory canal, outer one third is fibrocartilaginous, inner two third is bony. And the tympanic cavity communicates with the mastoid antrum through additus ad antrum. So with this knowledge, let's have a look at a series of images. Now I am showing you images. This is a CT scan axial view from inferior to superior. So we'll talk about the facial nerve at the end. Now just have a look at the first structure that we come across while we go from inferior to superior. This, let me highlight the pointer. Okay, this structure which you see, this is the posterior semicircular canal. Now as I'm going above, this structure you can see is the cochlear aqueduct. So when I come from inferior to superior, the first structure, again I'm going from inferior to superior. The first structure that we see is the cochlear aqueduct. It is located inferiorly. Then comes the posterior semicircular canal. Then we have the basal turn of cochlea. And as I'm going above, you can see this structure, rounded structure over here. This is the round window. You can see this opening over here into the middle ear cavity. Now again, I am going above. So what do we see now? These are the cochlear turns that is becoming visible. Now this is the vestibule. This is again the posterior semicircular canal. And now superiorly as we are going, we can see this is the superior semicircular canal. So these are the inner ear structures. Now I'll come from superior to inferior. Now let's focus on the facial nerve. This is the internal auditory canal. This lies at a superior level compared to the cochlear aqueduct. The cochlear aqueduct is located inferiorly. Now this is the internal auditory canal. Now as I am going down, this part you can see this slender hypodense structure. This is the labyrinthine segment of the facial nerve. From the internal auditory canal, this is the labyrinthine segment of facial nerve within the bony labyrinth, and this you can see an angle over here. This is the anterior genu of the facial nerve. Now as I'm going below, you can see this is the continuity of this genu. This is the tympanic segment. Wait, I'll just show you from above. Okay, so this is a labyrinthine segment. This is the genu. And as I'm going below, look at the continuity. This is the tympanic segment of the facial nerve. You can see this continuity over here. This is the tympanic segment of facial nerve. Just follow this over here. And now we have come to the mastoid part. And this is the mastoid part of the mastoid segment of the facial nerve. And as I go below, this exits from the stylomastoid foramen. This is the styloid process. This is the mastoid segment of the facial nerve, and it exits at the stylomastoid foramen. So we have been able to trace the entire facial nerve in this. Now, let's focus on the ossicles now. So from superior to inferior. So as I'm going inferior, this is the superior most cut. This is the superior semicircular canal. As I'm going inferior, what do we see? This is anteriorly the tympanic cavity. This is the mastoid antrum. This communication is the additus ad antrum, which communicates the tympanic cavity with the mastoid antrum. And what we can see over here, This is the malleus and this is the incus head. Incus is located posterolaterally and malleus is located anteriorly. So these are the ossicles in the epitympanum. Now as I go below, what I can see, this is the short process of incus as well as the malleus, and this is the long process of incus and a tiny dot-like structure which is a stapes. The handle of malleus, now the tympanic membrane over here is not shown on the CT scan. Sometimes it is not seen. So the one which is going laterally and attaching to the tympanic membrane, this anteriorly located structure is the malleus. This is the malleus handle which attaches to the tympanic membrane. So clear about the structures, or do you want me to repeat it?
Dr. Nivedita, I think if it is a bit, you could make it a bit slow, because I think even for me, following it very fast, we are not radiologists and expert like you. So I would request if you could tell us the facial nerve anatomy a bit again, because I think few people joined a bit later, if it is possible.
Yeah, of course. So
And a bit slow, because it will be easy to follow. Yeah, thank you.
okay. So now this is a superiormost cut. Okay, so I am now going from superior to inferior. Let's just focus on the facial nerve. So from superior to inferior, I am just going slice by slice. This structure that I'm seeing here is the internal auditory canal. Clear? Now, from internal auditory canal, you can see a slender hypodense structure emanating within the bony labyrinth. This slender structure is the labyrinthine segment of the facial nerve. So this is the internal auditory canal. This is the labyrinthine segment of the facial nerve. Now, as I am going below, you can see this is taking a turn. There is a bend over here. Can you appreciate this? It's going over here, and then there is a bend. So the anteriormost portion, that is the genu. Bend is the genu. So as I am going down, you can clearly appreciate the genu over here. So internal auditory canal, the labyrinthine segment of facial nerve, this is the genu, and you can see it is now again retracting posteriorly. So labyrinthine segment going anteriorly, there is a genu, and then as an angle now it is going posteriorly. Now as it goes posteriorly, this is the tympanic segment. This portion is the medial wall of the middle ear cavity. So this houses the tympanic segment. This slender structure at the lateralmost wall is the tympanic segment of the facial nerve. Now I am going below slowly. This structure, just follow this slender structure over here. So just follow this posteriorly, this structure over here. This one, this dot-like structure. So now we have reached the mastoid portion. So this is the mastoid segment of the facial nerve. It actually descends vertically. So I will show you on another plane as well. So you will be better able to appreciate the mastoid segment. So as I am going inferiorly, this is the mastoid segment. Just follow this part. Okay, and now you can see that this is the stylomastoid foramen. This is the styloid process. You can see this is going anteriorly. This is the styloid process, and just lateral to this, look at this rounded structure. This is the facial nerve, which is exiting at the stylomastoid foramen. So this is the entire segment of the facial nerve. Okay, so I'll just show you in a better way in the coronal plane. So this I'm coming from posterior to anterior. This is the coronal plane, and now I'm coming from posterior. You can see the mastoid antrum over here, air-filled cells. Now I'm coming anteriorly. Okay, so this you see, this is the mastoid segment of the facial nerve. Okay, now you can trace this dot-like structure which you can see. This is the facial nerve. I'll again go back. Just concentrate on this dot over here, just lateral to my pointer. So this dot over here, now this, it is going below, descending vertically. This is the mastoid segment of the facial nerve. Okay, now I am coming more anteriorly. Now just follow this dot over here. Just follow this dot. So now you can see this air filled space, lack of bony wall. This is the oval window to which the stapes is attached. So this facial nerve, the tympanic segment of the facial nerve, it lies between this oval window and the lateral semicircular canal. This is the vestibule and these are the semicircular canals. So as I'm going anteriorly, you can see again that these two structure like the snake's eye. One is the labyrinthine segment of facial nerve and one is the tympanic segment of facial nerve. You just have to follow these dot-like structures. And here it is joining to become one. So again, I'll go and trace. Let's again retrace this. So this is the facial nerve. Now I am going, you can see it separating into the labyrinthine part and the tympanic part. Now let's trace this tympanic part. You can see it has come to rest over here, this dot-like structure. This is the oval window which is devoid of bone. You can see over here this dot-like structure between this lateral semicircular canal and this air containing round window. So now as I am going further posteriorly, you can just follow this dot. This is descending, this is the vertical segment which is the mastoid segment of the facial nerve. And the semicircular canals is already well seen over here. This is the lateral semicircular canal. This is the superior semicircular canal. Okay, the posterior was better seen on the eggshell scan. And these are the ossicles. Okay, so now in the ossicles, this you can see this bony protrusion over here. This is the lateral wall of the tympanic cavity. This bony spur is actually known as the scutum. So this scutum, between this scutum and the medial wall is the epitympanum, above the level of the tympanic membrane. The tympanic membrane is not appreciated in many of the scans, but you just have to follow. There's a slender line over here. I don't know whether you can appreciate this. It's too slender. So which is attached above to the scutum. So above the level of tympanic membrane, whatever structure you see in the middle ear cavity, that is the epitympanum. The epitympanum houses the head of the malleus as well as the incus and the short process of the incus. So you can see over here there are two bones. So medially located is the malleus, the laterally located one is the incus, and this is the short process. And now when I come to the mesotympanum, now it has descended from the level of scutum. So now whatever I am seeing is the, you can appreciate this. Okay, this is the long process of incus. So which is located in the mesotympanum. Okay. So you can see the structure over here. This is a long process of incus. It is turning. There is one slender bone over here, that is the stapes, which is, this is the oval window to which it attaches. You can see there is a gap. There's a bony defect. This is the oval window. The stapes is a very slender, very fine bone. So it is attached to the long process of incus. So this is a long process of incus. That medial angulation that you see over here, you have the stapes over there. And then this bone, it is directly attaching to this, a bit of a bony defect that you can see over here. This is the oval window, and you can see that this facial nerve, as I spoke to you about, the tympanic segment of facial nerve is located between this oval window and the lateral part of the semicircular canal. And you can still see this dot over here. This is the facial nerve. Okay. Do you want me to repeat it?
I think it is okay, Nivedita. We can see the other sections also if they are there.
Yes. So
And
let's go to in the SAG. The only thing that I wanted to show you is the adductus ad antrum, because it is a communication it's a connection posteriorly between the tympanic cavity anteriorly with the mastoid air cells posteriorly. So this is the adductus ad antrum. And this you can see is the mastoid segment of the facial nerve. You can see this clearly. It is descending below. It's a straight vertical segment. This is the mastoid segment of the facial nerve, and this is the styloid process. So it's just located posterior to it at the stylomastoid foramen. It exits. So this is the mastoid segment, and you can again follow it above. And these are the semicircular canals, and these are the malleus and incus. So posterolaterally is the incus. So posterior one is the incus, anteriorly located one is the malleus. Okay, now, so I think now I'll show you the MRI. Basically, MRI is required for visualization of the cochlea, the vestibule, and the cranial nerves. So over here, the 7th and 8th cranial nerves. So now I am going, this is the inferior most cut. Now I'm going above. This nerve which you're seeing is the hypoglossal nerve. So just above that, the first nerve that I come across over here, the first nerve, this is the cochlear nerve. So cochlear nerve, the internal auditory canal contains facial nerve, cochlear nerve, superior and inferior vestibular nerve. So again, if I come from inferior, the first nerve that I come across is the cochlear nerve. It is located antero-inferiorly along with the inferior vestibular nerve. Now, as I go above, another nerve that I come across, this is the facial nerve. The superiormost nerve that I see anterosuperiorly, this is the facial nerve. Facial nerve is located along with the superior vestibular nerve. So anterosuperiorly we have the facial nerve, posterosuperiorly we have the superior vestibular nerve, antero-inferiorly is the cochlear nerve, and postero-inferiorly is the inferior vestibular nerve. Most commonly, it is the facial and the cochlear nerve which are visible together, and the other nerves are too fine. And you can see these structures over here, these inner ear structures over here. This is the vestibule. This is the cochlea. You can see this is very well seen. So in cochlear malformations, MRI is a must. And you can see this vestibule as well, because they are fluid filled with endolymph. And you can see as I'm going above, this is the superior semicircular canal. The topmost part, as the name suggests, this is the superior semicircular canal. Now this, the one which is going, this is the lateral. The one which is going posterior is a posterior. The lateral semicircular canal is best appreciated on the coronal view, as we have already seen on the CT scan. And it is a short process, whereas this is the posterior semicircular canal. So, okay. So now, shall we move to the skull base, or you want me to again revise those structures?
So Nivedita, I think we can continue further because I think there will be questions subsequently. If there are, we can come back at that time if there are any queries. Yeah.
Sure, ma'am. So now skull base. So again, CT is the imaging modality of choice for these structures. But MRI, if you want to visualize the nerves, then MRI comes into picture, acts as a complementary imaging modality. Now again, I'm coming from inferior to superior. So let's have a look at all the structures. So this is the C1, the anterior arch of C1. This is the dens. Now this is the condyle, occipital condyle. Now as I'm coming above, just have a look at this gap over here. Okay, this gap is the hypoglossal canal. If I go further above, I can see a gap. Just a minute. This, from below I'm coming, this is the hypoglossal canal. If I go above, again posterolateral to it, this is the jugular foramen. So below is the hypoglossal canal. Above, as I go laterally, posterolaterally, this is the jugular foramen. Now again I am going above. Temporal bone we have seen. Now this is the sphenoid bone. This is the sphenoid bone which has the foramen ovale and the spinosum. You can see anteriorly is the foramen ovale. Posteriorly, this dot-like structure is the spinosum. This is located in the greater wing of the sphenoid. Now, as I go above, now let's look at the boundary first. So, I'll come back to the pterygopalatine fossa later on. I just wanted you to see the boundary. So, this is the, again, the body of the sphenoid. The posteriormost part is the dorsum sillae. And posterolaterally, this is the petrous part of the temporal bone, which we have already seen. This acts as a boundary between the middle cranial fossa and the posterior cranial fossa. And now I'm going again below. Again, I'm coming from inferior to above. Now let's focus on the communications of the pterygopalatine fossa. So look at this. What are these structures? This is the greater palatine canal. And now I'm going above. This is the greater and the lesser palatine canal. Just look at them. They are joining. And as I'm going above, they are communicating with this structure over here, this space over here. So this is the pterygopalatine fossa. This is the pterygopalatine fossa. So inferiorly, this pterygopalatine fossa, it communicates with the greater palatine canal or the greater and lesser palatine canals. Clear? Now, as we go above, now focus on this canal specifically. Now you can see this canal is opening posteriorly over here as well as posteromedially. So posteriorly, this is the Vidian canal. This is the pterygopalatine fossa. Posteriorly, inferiorly, it opens into the Vidian canal. This is the foramen lacerum. It's not a true foramen. And medially into the nasopharynx, it opens via the palatovaginal canal. Now again, if I go a bit above, it opens into the nasal cavity via the sphenopalatine foramen. So you can see all the three at one place. This is the pterygopalatine fossa. Now I'm going above. I can see one posterior linear communication. This is the Vidian canal. Posteromedially, we have the palatovaginal canal which communicates, through which the pterygopalatine fossa communicates with the nasopharynx. Then again, if I go the medially through the to the nasal cavity, it communicates via the sphenopalatine foramen. Now as I go above, I'm going above now. Just follow this pterygopalatine fossa. Here, this it's not a true eggshell, and therefore you can see over here, this is the foramen rotundum. So again, I'll go below. I'm going above. So we are done with Vidian canal. As I'm going above, this is the foramen rotundum. This side foramen rotundum, it's a bit oblique, and therefore this side foramen rotundum has appeared now. So this is the foramen rotundum. Now this, if we follow again, this is the inferior orbital fissure. So again, I'm coming from below above. We've seen the Vidian canal opening. Now we are just tracing this pterygopalatine fossa. We are tracing it above. We are just going above. We see another opening over here. And this is the foramen rotundum. So this is the pterygopalatine fossa. As I go above, this is the inferior orbital fissure. I go further above. So above now, as I go above, I can see this is the superior orbital fissure. This is the anterior clinoid process. This bony structure is the anterior clinoid process, the posteriormost process of the lesser sphenoid wing, lesser wing of the sphenoid. And this is the medial to it is the optic canal. So this is the optic canal. This gap over here into the middle cranial fossa is the superior orbital fissure. Okay, and this anteriorly located structure, this is the crista galli. So it is, how do we divide between the anterior and the middle cranial fossa? So this is via the lesser wing of the sphenoid, the anterior clinoid process. This divides it's a landmark between the anterior cranial fossa, all the structures located anterior to it, and the structures located posterior to it is the middle cranial fossa. And we have the middle cranial fossa till the dorsum sellae, which is a posteriormost prominence of the sphenoid bone. So Clear till now?
Yes, Nivedita.
So now let's go to the coronal section. Here also again you can see this is the mastoid segment of the facial nerve. Now I'm going from posterior to anterior. Now let's focus on this structure. Okay, so now just look at this structure. This is the foramen ovale. I have come from posterior to anterior. So this structure is a foramen ovale. I'm going further anterior. Further anterior. These two bony structure is the anterior clinoid processes. Now I'm going further anterior. You can see these two roundish foramen. The lateral one superiorly located is a foramen rotundum. That's what we have seen on the eggshell as well. The inferiorly located medial is the median canal. So this is the foramen rotundum. This is the median canal, medial and lateral plates of pterygoid. Now again I'm going anterior. So this foramen over here, this is the optic canal. Okay. You can see this is entering the orbit. So this, just follow this. This is the optic canal, which is limited laterally by the anterior clinoid process. So foramen rotundum, median canal, this is the optic canal. We go further anteriorly. This is the ethmoid bone. This is the roof of the orbit formed by the frontal bone. Now as I go anteriorly, I can see this prominent structure. This is the crista galli. Now the floor of this anterior cranial fossa is formed by, you can see this slender horizontal bone adjacent to the crista galli on either side, horizontally located. That is the cribriform plate on either side. Right cribriform plate, left cribriform plate. And you can see an upsloping arising from this horizontally located cribriform plate. That upslope is the lateral lamella of the ethmoid plate. This one, the upslope. Now again further another bone that we can see, this is the fovea ethmoidalis. So we have the cribriform plate. I'll see if I can get a better view. Yeah, so you can see this is the cribriform plate, the horizontally located. The upsloping part is the lateral lamella of the ethmoid plate, and this is the fovea ethmoidalis. This is the crista galli to which the falx cerebri is attached. So any doubt with this?
Yeah, I think it is going great, Nivedita.
Okay, now in the sagittals section, the one thing that I wanted to show is the planum sphenoidale, which is very important. This is the roof of the sphenoid sinus. This area is the planum sphenoidale. This is, of course, the sella, and this is the dorsum sellae. This is the clivus. Okay, now this this is T1 weighted eggshell MRI. I just wanted to show this to let you know that on MRI, whether or not there is a perineural spread, that is best visualized on a T1 weighted image, not on T2. T2 is best for characterizing the nerve, but T1 is the best sequence to is a highly sensitive sequence to see whether there is perineal spread or not, because it has a very good contrast between the soft tissue and the fat. You can see this is the pterygopalatine fossa. Of course, this is a normal pterygopalatine fossa. It has fat within. So a slight effacement of this will hint towards some kind of a perineural spread in case of head neck malignancies. So this is all I wanted to show you. Please let me know what your doubts are. I am happy to show them again.
So I think, Nivedita, there are few questions. One is, can you show the vestibular and cochlear aqueduct once again, and endolymphatic duct and SAC2?
So we can see vestibular aqueduct and just a minute, cochlear and vestibular aqueduct is visible. Definitely. So I'll show you those. Let's see from here. So I'm coming from inferior to superior. Okay. So just focus on this area. Okay. I'm going slowly. I'm coming from inferior to superior. Okay. This structure anteriorly inferior locate. This is the cochlear aqueduct. This structure is the vestibular aqueduct. I'll go inferior again. Okay, now I'm coming from inferior to superior. The first thing that you see is the cochlear aqueduct. Now this structure over here, you can see in continuity. This slender thing. If I go below, this is the, I don't know, is my pointer there? Okay. Okay. So from inferior to superior, this first structure that we come across, this is the cochlear aqueduct. This one. Do not confuse this with the internal auditory canal. Internal auditory canal is located at a higher level. Therefore, I am going from inferior to superior. The first structure anteriorly, inferiorly located is the cochlear aqueduct. And now let's focus on this. This is the vestibular aqueduct. Next comes the vestibule, this slender linear structure. Here below, inferior to superior as I'm going. Do not confuse this with the semicircular canal. This is a semicircular canal. This is the vestibular aqueduct. Yes. Anything else?
I think there is one more question. Cochlea on CT scan.
This is the cochlea. You can see there's a bony modulus as well. And this is the cochlea. So I'll just go from, this is the basal turn of cochlea. This one. Okay, I'm again going from inferior. I'm coming from inferior to superior. So this is the cochlear aqueduct is the first structure that we see inferior. This is the basal turn of cochlea. This is the round window. Again, now we are seeing the entire cochlea. Cochlea is located anteriorly, vestibule is located posteriorly. So this entire thing is the cochlea. Now the cochlea ends over here. And this is the internal auditory canal. So internal auditory canal is located superiorly, and as we go inferiorly, that is the cochlear aqueduct.
So, Nivedita, next question is, can you show signs like snake eye sign?
Yes, snake's eye is the facial nerve, labyrinthine, and the tympanic segment that we see on the coronal view. Okay, so, all right. So let's trace the, it's not quite well seen, but these two dots, tiny dots. This is the medially located is the labyrinthine segment of the facial nerve. This tiny dot is the tympanic segment of the facial nerve. This is actually called the snake's eyes. But this is nothing but the
They look-
labyrinthine.
Yeah, they do look like eyes. Yes.
Yes.
Okay. Ring sign.
Pardon?
Ring sign. Ring sign. Somebody has asked.
I don't know about the ring sign.
I know they are very much interested in lot of signs.
But then signs, it is that the structure you must be able to identify. It is not the sign that you are supposed to see. It's actually the structure. If you know the structure, how it is oriented, how it is going, you can, devise your own signs also. But it is actually the structure that you need to give.
I agree with you. Nivedita, can you please show the hypoglossal canal, jugular foramen, and its crest once again?
Sure. I'll just.
That's why I said we'll be asking you again and again to show.
Oh, that's why I have kept it only imaging based and see
Yes.
images I've collected, because theory part everybody can read up. It is the identifying the structures on imaging which is essential. So, okay. So let's see this. Okay, again, I'm coming from inferior to superior. I'm going superiorly. Here's my pointer. Yeah. So I'm going inferior. The first thing that we come across is the hypoglossal canal here. Okay, so this is the hypoglossal canal. And as I go superiorly, posterolateral to it, this is the jugular fossa. So do not get confused. This is jugular fossa. This is a wider canal. And as I go inferiorly, there's a small gap medial to it. This is the hypoglossal canal. Okay, this of course is the carotid canal.
Nivedita, can you please show how to trace the pathway of PNS for V2, V3 on MRI?
So this okay, V2, V3. Now V2, you know the foramen rotundum. V3 is, okay, I think I should be having the section. Okay. So this is the mandibular foramen, right? This is the mandibular foramen. You have to just follow this. Since I have not included the soft tissue part over here, but you just have to trace this. Maybe that can be another class, tracing the nerves. So
We'll be having one class anyways for PNS radiology also.
yeah,
So
so
that should
this is how you trace, and V2 is basically in the foramen rotundum. I have told you how to see the foramen rotundum as we follow the pterygopalatine fossa superiorly. Then we come across this gap. This is the foramen rotundum. So if there is any effacement on T1, or if there is any widening of the foramen on CT scan, so then that would imply that there is a perineural spread.
debrief from plate, I think, which you already showed.
Which, ma'am?
Debrief from plate.
From plate. Okay, okay.
Yeah,
Right.
you already showed that. Yeah.
I can show that again. That's not a problem. So coming from posterior to anterior. Okay. So as I'm going anterior, so this horizontal, there's a crista galli adjacent to it, those horizontal thin bone that you see on either side, that is a cribriform plate. Here, only the horizontal part. Appreciate. This is the cribriform plate, which houses the olfactory fossa.
Yes. So I think another question, pterygopalatine fossa, what would you suggest, CT or MR? Which is better?
So it's complementary. Initially you can see on CT scan the indirect sign are, as I said, widening of foraminae. They are the indirect sign. But for actually visualizing the superior communications, it is MRI. As long as it is at the skull base level, it will be CT scan. But when we want to see the communications, through foramen rotundum, inferior, superior orbital fissure, then that will be MRI. That will give a better idea. And also T1 weighted MRI will it will be more sensitive for visualizing the subtle perineural spread. And as we go higher up intracranially, again the role of MRI will keep on increasing. Till it is at a lower level, it is CT. As we go superiorly, it's MRI.
So when will you say pterygopalatine fossa is involved? Just when it involves the part posterior to greater and lesser palatine foramen, or above that?
No, so greater and lesser palatine foramen, if it is effaced, and the pterygopalatine fossa, that's what I'm saying. If the pterygopalatine fossa is asymmetrically widened on one side, then that is an indication on CT scan, that is an indication of involvement. If only greater palatine nerves and they are effaced, the tumor is directly over there, that is enlarged, then I'll just call it that it's a greater or lesser palatine canals, or the foraminae, they are effaced and it's not extending up to pterygopalatine foramen. But for that, MRI will be a more sensitive modality, as effacement before widening of the foramen, the effacement of fat will come into picture. That is best visualized on T1 weighted image.
Right. So rotundum is seen as a horizontal split line in axial scans, whereas ovale is seen as a oval shape. Is it like that? And so they want to see the rotundum and ovale. I want to know about that.
Okay, so I will just show again. Okay, so this is the inferior part, just going inferiorly. Just going more inferior. Okay, now I'm coming superiorly. Now I'll just show my pointer. Can you see my pointer?
No, you can see only the arrow.
Yeah, arrow is seen, right? Okay.
Yeah, now we can see the pointer.
Now let's look at this is the greater wing of the sphenoid, this bone. Okay. So now this is anteriorly located, oval shaped is the foramen ovale. This is spinosum. So this is oval shaped and hence the name foramen ovale. Okay. So this is in the axial section. This is how it is seen. Now focus on this pterygopalatine fossa as I'm going above. Okay. As I've told you about the communication median, and then here, this is the foramen rotundum over here. Okay. This is a slit-like opening. This is the foramen rotundum. Okay. Now on coronal scan, I'll just show you the coronal scan. You can see the foramen rotundum as a roundish structure because of its orientation, and foramen ovale as a slit. Because over here you can see that the foramen ovale is oval shaped, and on coronal the orientation changes. Okay, so now from posterior to anterior, I'm coming. Okay, so this part is the foramen ovale, naturally located. Further anterior, you can see this two roundish structure. This is the foramen rotundum. I'll again go posteriorly. This is the foramen rotundum. This is the Vedian canal. This laterally located is the foramen rotundum. And this is now another structure. This is the superior orbital fissure and inferior orbital fissure. Not clearly seen as fissure over here. And this is the optic canal.
So Nivedita, there is lot of interest as expected and lot of questions. I think we'll take an last two questions. That can you describe the extent of pathology in the HRCT temporal bone? I think we don't have the pathological lesions here, right? Lesions we don't have. It is a regular anatomy which Nivedita has included. Hello?
Yeah.
Yeah.
Yes. Yes, ma'am.
And last question, even though we'll be having Prahlad next, one of the classes will be on radiological anatomy entirely for PNS. But there's one question, if you can answer, Nivedita. And last question, does contrast add to accuracy of PNS detection in CT?
Yes, so not for PNS detection in CT scan. So contrast is not of value on a CT scan for PNS detection. It is the, indirect signs, widening of foramen. You can see the thickening compared to the opposite side. Contrast is of value in the post-treatment changes because in post-treatment scan, if that nerve is within the field of radiotherapy, then it will invariably be thickened. But if it is enhancing, then it will indicate that there is an active perineural spread because fibrosis will also make the nerve thickened, but it will not be enhancing. It will not add so much of value in the upfront baseline scan to detect perineural spread. That will be of value in the post-treatment scan to differentiate it from fibrosis and to true neural perineural spread from fibrosis.
Right. So I think with this, we conclude our today's lecture. Nivedita, thank you so much. You patiently answered each and every question, lot of questions. And I'm sure there are going to be lot many questions, but now we have to conclude. And thank you once again for another wonderful lecture. Thank you so much, Nivedita.
Thank you. Thank you.